And good evening, everyone. You're at week 3 of the purification program. I'm proud of you. I know it's been a struggle for some of you, and I know others have not had too bad of a time. Just like we were just discussing what a great opportunity this is for just a reset for the year and just take a look at and reevaluate what you actually eat in your diet. I think I'm funny, so you have to excuse all my little cartoons I put in here because I just think they're funny. So there you have it. So those of you that got to come to the class or usually come to the class, this is what I made for dinner last night. It was a crock pot chicken curry, and it was really super easy to make. I wanted to do that, and I will just give you a little. I was trying to figure out what I wanted to do. So I was looking at some recipes I'd already done, and so here's what I did. I did Chat GPT, and I put in dairy-free, uh, 6 or less ingredients, keto, crock pot, and chicken. And it came up with the recipe that I'm going to show you. So it was super easy to make. And that's for me, it's like 5 and 6 ingredients. What you see there is all it took. And, I love that part of it when it's super simple. And you just put it in the crock pot, and there you go. So it's just chicken, coconut milk, red curry paste. You could use a green curry paste if you wanted, red bell pepper sliced, broccoli. I sliced that up in the little flowers of it. I did some matchstick carrots, and I did a yellow onion, and I did some garlic, elephant garlic, which is really strong. And you just cubed the chicken, put it in the bottom of the crock pot, mixed up the full fat coconut milk, added in the red curry paste, poured that over top. Then I just layered the veggies and put the lid on it and put it on high. And in about 3 hours, I just started to stir it because then I could see that the chicken was done. Super delicious. I served it at the office with just that. I was going to try to do it over a bed of cauliflower rice, but it gets too mushy because I prepare too early. But over cauliflower rice would have been awesome to do. So it's really simple to do. This recipe will be in the Facebook page. If you don't, if you're not on the Facebook page, please reach out to the chat and Danny will get that sent to you. All right, 15 through 21, nothing changes. It's still the same. No corn, no peas, no white potatoes, and you know all the things that you can have. You can have unlimited salads. Make sure you use a good olive oil, extra virgin olive oil. You can add lemon spices to your salad dressings, just no commercial salad dressings because they are going to be full of sugar and hydrogenated fats. Still the same rule, eat twice as many veggies as fruits. I'm limiting, all those really heavy sugary fruits because I know what you'll do with them. And if you're on a weight management program, or if you're having some blood sugar issues, I want you to be gentle with the quinoa. Limit it to either quinoa or lentils, one or the other per day, half a cup of cooked per day, and limit that to maybe a couple times a week. So, and if you wanted to be me sprinkle over your salad, that's fine to do, or sprinkle over vegetables. I'm okay with that as well. Using your good olive oil, your extra virgin olive oil, your coconut oil, make sure it's expeller pressed and organic, flaxseed, avocado oil, grass-fed butter, and remember to read your labels because you can go to the grocery store and get Luann's coconut oil and it's not expeller pressed, it's hydrogenated, so you're just defeating your purpose. Spring water, herbal tea, you can have your mineral waters, your fuzzy waters, as long as they don't have sugar, at least 8 ounces of glasses of water per day. And still on the 20 capsules per day, you do 2 to 3 shakes per day. And if you don't have to do 3, what I suggest is maybe limit it to 2 and then just do extra scoops in both. And just make it a bigger shake and a little bit extra protein in the 2 shakes. 3 gastrofiber twice a day, that'll be 6 capsules. 5 green food, 2 times per day, 10 capsules. And then the 4 GI adsorb before bed with a full glass of water. And that continues for another 7 days after we're finished. So don't be worried about that. It's just like I said, just help. If I find it really helped with some extra cleanup. Let's talk about some seed oils. And we can't even call these vegetable oils because cottonseed is not a vegetable. Safflower is not a vegetable. Canola is not a vegetable. So you're getting these oils that are being have to be hydrogenated to be able to be utilized. And we call these the hateful eight: canola, corn, cottonseed, soy, sunflower, safflower, grapeseed, and rice bran oil. They are considered polyunsaturated vegetable oils. And these are and peanut oil is just the one. And these are what happens with these is they can boil them at high rates. And that's what they use in the fast food restaurants to keep the food crunchy, and they can bring it up high and it lasts a long time. It doesn't break down easily. When we talk about trans fats, we're talking about, we have to have a little cholesterol discussion here. So remember, in your cholesterol, your HDL is your good cholesterol. That's like the WD-40 for your arteries and your veins. The LDL raises your bad cholesterol. Now, LDL is not bad. It's found at the scene of the crime, but it's the one that really will close up your arteries and your veins. So we do need it. The bad one is VLDL. That's the very low density lipoprotein. And a lot of your practitioners out there are not testing a complete lipid panel. So the VLDL is the sticky stuff in the J trap of your sink, that if you've ever cleaned that out, it's nasty. And that's what the VLDL is. That's the very sticky low density lipoprotein. And when it breaks off, if a piece goes to your heart, you have a heart attack. If a piece goes to your brain, you have a stroke. And we all remember these. And if you can look up here in the right corner, you can see it's just loaded with sugar: soybean oil, palm oil, dextrose, another form of sugar, high fructose corn syrup, still another sugar, partially hydrogenated cottonseed oil. So it's just loaded with a bunch of chemicals, and you can see the problem there. They limit the fat, but they just load it up with sugar. And remember, those cookies are not very big. They are very disappointed. And you see these things here, and you're like, oh well, I'm doing good, but are you really? And you can see there in the trans fat, they don't even show that there's trans fats, where clearly in the ingredients it demonstrates that. Well, how can they get away with that? Oh, I'll help a brother and sister out here. And then we look at these vegetable oils, these spreads, these margarines, and clearly we're being misled because they say no trans fatty acids twice on this label, but clearly liquid canola oil, partially hydrogenated soybean oil, polyglycerol esters of fatty acids, hydrogenated soybean oil. So not only do they have partially hydrogenated soybean oil, they have hydrogenated soybean oil. And it says it lowers your LDL cholesterol up to 14%. But it's not just the LDL that we have to worry about. It's the triglycerides, it's the HDL, and it's the VLDL. And this gives you a nice comparison. On the right-hand side, you can see that these are butters and spreads, and they're butter substitutes. I can't believe it's not butter, because it's not. But look at the ingredients in there. Anything in red is an oil that's been hydrogenated, and then other chemicals as well. And none of which are any kind of health. And if you look to the left, you see saturated fats versus trans fats. And just the cause, how saturated fat, which comes from your chicken, your fish, your meat, are essential for healthy function of your cell membranes. It enhances hormone production, it suppresses inflammation, lowers your little protein A, raises your good cholesterol, puts omega-3s into the tissues and conserves it, and helps insulin receptors if you're diabetic. Also enhances the immune system and encourages production and balance for your prostaglandins, which are your estrogens and your hormones. And then the trans fats do exactly the opposite. So this is why we want to stay with you. Have you stay away from these, because of the just the danger it is to your system. They're young, they're in love, they eat lard. Yes, this was a commercial. And this is a chemist herself. As for butter versus margarine, I trust cows more than I trust chemists. When we look at those trans fats, they're in these foods: French fries, donuts, chicken nuggets, cakes, breads, pie crusts, all these, ice cream, microwave popcorn, candy, margarine, potato chips, pastries, pizza, biscuits. 40% of the foods in the typical US supermarket are trans fats. And if you look at, I did this picture last week, and the ants are much smarter than we are. They go to the natural butter right off. And the reason we use these things, because they keep the foods really fresh on the shelves for a long period of time. Good for not the consumer, good for the manufacturer, but just not for the consumer. So here's the labels that you see, and there's a lot of controversy with this. And it says grams of trans fat, but you clearly saw in those other labels where there was trans fats included. Well, how can this happen? Well, here's how it happens. The FDA says that a label can say 0 grams of trans fat if the food contains less than 0.5 grams of trans fat per serving. So it may have trans fats in there, and clearly this label, I do my little shopping at Publix and take pictures, and I get everybody upset because they think I'm from corporate or something. They're running around straightening the shelves, fluffing the bread. But a serving size of croutons, and who eats 5 croutons, um, has 0 trans fats. But if you look into the label right there, it says partially hydrogenated soybean oil. There's a little high fructose corn syrup in there. So clearly there's oil and there's a soybean oil down below. It's in there, and that's how they get away with saying that. And then again, no preservatives, no cholesterol, and no cholesterol. I always say duh, because cholesterol comes from animal fat and not no vegetable. So 0 trans fats once again, but clearly there's in there, but there's 0.5 grams. So here's the danger. Less than 0.5 grams is dangerous to your system. 0.5 grams and less is dangerous. If you eat 5 croutons, you get that 0.5. If you eat 10 croutons, you've gone way over the limit. And this is what clogs our arteries and causes heart disease and causes all these other maladies that we see people suffering from these days. So all fats aren't bad. There are good fats versus bad fats. Good fats are your butter, your grass-fed butter. We use Vital Farms, and there's another one called Truly that are grass-fed, from grass-fed cows. Lard, chicken fat, cold pressed olive oil, which is extra virgin olive oil, sesame oil, as long as it's expeller pressed and organic. Your flaxseed oils, your tropical oils, coconut and palm, if they're expeller pressed and organic. And your fish liver oils, that's from your cod liver. And remember, the importance of cod liver is that it has the omega-3s, but not only does it have omega-3s, it has the liver from the cod, which has naturally found vitamin A, naturally found vitamin D, naturally found vitamin E, selenium, and then it also has the omega-3s. And remember, we have two parts of the omega-3s. There's the EPA and DHA, and your brain is made up of 65% of DHA fat. And if I tell you you have a fat head, it's a compliment. The EPA actually feeds the brain, feeds that DHA. And the important thing about that is for Alzheimer's, for any neuroinflammatory disorder, when we think, our brain creates waste, just like your car has an exhaust. When we think and we create waste, if that waste is not taken out, it causes the neural fibrils to tangle. The tangling of those neural fibrils is what causes that neuroinflammation, and that's what causes Alzheimer's and Parkinson's and dementia. So in order for the neurotangling to be minimized, the fish oils are responsible for taking out the trash. And this is well proven. There's research out there, peer-reviewed research that you can just access through the interweb. And then you can have all that information that you need to find that out. But that's why we incorporate the fish oils. And not only is it good for our brain, but it's good for our heart, it's good for our face, it's good for our skin, our eyes, our bones, our joints. And then, I mean, I'll just go back to here is that you can see, when we talk about hidden trans fats, these are the names you'll see. Canola is not a vegetable, and we call these vegetable oils. They're not vegetable oils, they're seed oils. I like to call them crap oils. But that's what you want to look for on your label. So let's talk about reading a label. I do this because I always know how to read a label, but I forget that some of my patients don't know that. So when you look at a label, it'll say the serving size, the amount per serving, the calories, and they're so darn concerned about that fat, they put that there. So it's always listed in this order: your fat, cholesterol, sodium, potassium, your carbohydrates, and they'll break the carbohydrates down into dietary fibers, sugars, and sugar alcohols. The fat is broken down into saturated fat and trans fat. And then you have protein. And it's always been curious to me, why don't they break down the protein into amino acids? You have to think about that. And then your vitamins down below that. So if you look to the left here, 1 gram of fat equals 9 calories. 1 gram of carbohydrate equals 4 calories. And 1 gram of protein equals 4 calories. So we take, when we have 1 gram of fat equals 9 calories, we multiply that by this total fat, and that gives us 44.5. 1 gram of protein is 4 calories, and we multiply the protein for the is at 3.6, that's 14.4. The carbohydrates are 20.18, which gives us 80.72. The total calories is 139.7 for that serving. So there's a little miscalculation here up here because they have zero trans fats. And so they're just kind of hiding the fact. They're not letting you know, okay, well, you had saturated fat that's 2.91. Well, what's the rest here? So that's what I want you to do is when you pick up something, it'll make your grocery shopping take you longer. And then you'll get to learn. Like we wanted barbecue and I was too lazy to make it. So we went through every label on the barbecue shelf for barbecue sauce. And we did find a couple that didn't have extra sugar in it, didn't have any crap in it, and they were actually really good. So you have that opportunity, take it. Now, I say my saying about your nutrition is a choice, and it's either an act of nutrition or act of suicide. Well, this is really the nice way to say it. The food that you eat can either be the safest and most powerful form of medicine or the slowest form of poison. That's actually the nice way to say it. I just never remembered that. And being fit is 80% of your diet, and 20% exercise. You can't outrun your fork. And you have to be careful because we're marketed to all day long. And when you look at these things, what no sugar added means. Instead, we have included a variety of sweet tasting carcinogenic chemicals. Artificial flavoring means a horrible mix of chemicals that will trick your brain into think you're eating something healthy. Natural flavoring means a tiny drop of lemon or something added to that chemical crap listed in item 2. Low fat, instead of fat, we've added a chemical cocktail that is worse than fat ever was. And finally, the essential source of vitamins and minerals, we've added a salad of unavailable vitamins and minerals to hide the rest of the garbage that we are feeding you and your children. Lovely. And remember when I talked last week, we talked about isolates and when we talk about vitamins and what I love so much about Standard Process is they have their whole food vitamins. They're really high in phytonutrients. And our body knows how to utilize those phytonutrients. We have biochemical locks in our bodies. And phytonutrients have the exact key to go in and unlock that biochemical process. Isolates like vitamin C is a common one. If you read a label of vitamins and it's just off the shelf, it'll say ascorbic acid. Well, all ascorbic acid comes from China, and it's only one component of vitamin C. So it's considered an isolate. And when you take that isolate and put that key into the lock, it may go in, but it doesn't have what it takes to turn it. That's why I push so much for you to get nutrition-rich and fiber-dense foods. We can supplement with supplementation to make up the difference on foods you're not eating. Now, I added this part this time because I think it's really important, and this is what I see in my practice, especially we live in the land of the village people here. So sarcopenia, you're starting to hear that word more and more. For all practical purposes, it means flesh death. So what happens is when you start aging, when you get in your 50s, you start losing 1 to 3% of your muscle mass per year, men and women, and guess what we replace it with? Yes, that's correct, fat. So in my practice, I always say that I have two sides of my professional life. Number one, I'm saving people from themselves late in the game. And number two, making sure the above never happens. So when we're looking at our life, we look at what we call the physiological headroom. That's the difference between the most you can do and the least you can do. And then part 2 of that is the area under the curve, which we call the physiological headroom across your lifetime. We have to take into consider we're aging and the musculoskeletal system ages. We lose bone density around 30 years old. Women, it escalates because of menopause. Our joint cartilage becomes thinner. The proteoglycans become altered. And we have less resistance as we age. Our joints get stiff. Our range of motion is limited then, and connective tissue becomes rigid. And then muscle contraction speed decreases as we get older. So what is common is not normal. Back in the day, modern hunter-gatherers lived to be about 72 years old, taking out that included the effect of, infant mortality or death from infection or trauma. But they had a high physiological headroom into extreme old age. They had a large area under that curve. This is what we should strive for as we age. And this is what normal aging should look like. And I just throw a slide in here because I think I'm funny, but we're heterotrophs. We catch our own food. And that does not mean you go through Chick-fil-A or McDonald's and grab the bag as you go by the window. That's not what I'm talking about. But we have a choice in this, and we just don't make good choices. We have the biggest brain of anything, any mammal, and we still don't use it. So this is what we see, what I call common but not normal. This is becoming really, a crisis. We have there's not a lot of distance between the care receiver and that care provider. And this is what I was talking about, the physiological headroom. So on the left, you see the muscle area. On the bottom, you see the age in years. So if you start training when you're in your 20s and you maintain that through your 50s, 60s, 70s, you will maintain most of your muscle mass, a good up to 70 area, muscle area of 70, which is millimeters per square. It's just you don't need to know that. So then there's a bent age of curving. So if you don't work out, or you worked out a little bit when you're in 20, 30, and then you kind of stopped when you're 40, you have kind of a decline. So you start losing down to about 60%. Then if you're untrained, it's like a deep dive, it goes down. But then that was just a Signorelli's work out of University of Miami. But Patton Jones from University of Texas said, no, it's even worse than that. If you don't work out when you're in your 20s and 30s and you stop, from age 40, it's a stair step down to your death. And there's even research, out there that can, back all this. So I tell you this because I want you to make some changes. And aging and diseases of modern civilization are 100% related to muscle loss that occurs with aging, aka sarcopenia. And I bring this in because if you're not eating the right foods and supplementing the body with what it needs to maintain these things, that's also the other crisis that we have. So our musculoskeletal system, that's our bones, tendons, muscles, ligaments, and joints. It helps us move our bodies, maintains our structure and form. And you can see what happens as people age. They start to get bending in their spine. They get like a hunchback. They can't move. They can't lift their head. They can't turn their head. They can't get down on the floor and get back up again. And 1 in 2 Americans will live with some type of musculoskeletal condition. And when we talk about muscle mass and function, it declines with age. And if we're not doing something about it, the decline of muscle mass starts in our 30s. There's a significant decline in our 50s. And by your time you're 80, if you don't do anything, you have a grip strength of decrease of 50% between 20 and 80. And this is crucial. And this is why we are at fall risk as we age. And if we don't want that, our balance is off, or we don't have enough strength to get ourselves up off the floor or to balance to put a sock on. Arthritis in the United States, 54 million adults have some form of arthritis, and it increases as we age. It's more common in women or if you're overweight. Projected that 78 million adults will be diagnosed with arthritis by 2040. These are all preventable. This is all preventable. But if you don't know, you can't fix it. That's why I feel like it's important for me to tell you. This is what I teach my docs. And when I was teaching my docs one day, I was thinking, my patients need to hear this. So sarcopenia means loss of muscle mass, and these are the numbers I already told you. It said 1 to 2%, but it's actually 1 to 3% now. Muscle strength decreases between the ages of 50 and 60 at 1.5%, and then at 3% after that, it's just a quicker rate. So the more you exercise, and that means including that strength training, super important to do. Strength training is going to do it. Cardio is fine. But if you're walking, you're strengthening your legs. Unless you're walking on your hands, you're not getting strength in your upper body. So you've got to do some strength training. And the American Council of Aging gives us 10 biomarkers of health. So we look at these, and the number 1 and 2, I kind of put those together as muscle mass and strength. Remember, your skeletal muscle is your largest endocrine and immunogenic organ. If you have strength, it also talks about functional ability and balance. 30% loss of strength over 12 years can be restored in 1 year of strength training. That's just amazing. And here, this is a really deep slide. And I do this for my doctors. I give a little more science behind it, but it's so important. So when you exercise, you release what we call myokines. And myokines go into the bloodstream. And then to the effect of the bone, it inhibits osteoclasts. Osteoclasts break the bone down. Osteoclasts make it more fragile, make it more honeycomb-like. Osteoblasts build bone. So osteoclasts may come into play like if we have a fracture and they'll could be called into that area first, and then the osteoblasts come in to know where to go because of the osteoclast being there. In breast tissue, it inhibits cancer growth. In the pancreas, the GLP-1 secretion is affected. Now, where do we hear GLP-1? Yeah, that's Wegovy and Ozempic. Well, if you would exercise, your pancreas automatically releases that. Your gut that's where it comes from. You have a gut-brain connection. And the three things that are happening now with people that are taking these GLP-1s, and we all know people that are taking them. I have patients that are taking them. Number one, gastroparesis. That means a paralysis of the digestive system. The digestive system stops working. Number two, pancreatitis. Number three, Alzheimer's. Because of the gut-brain connection, the gut releases that GLP-1, the brain takes it, and the brain does what it needs to do to tell the body to inhibit, the hunger and all that kind of stuff. When you're just giving the GLP all the time, the intestines don't have to work. So they're like, okay, I'm on vacation. And then the brain's like, well, I don't need to do anything. So that's where the Alzheimer's comes in. So this is very crucial. And in the gut, also suppressing tumors in the colon, tumor cancer. In the liver, it helps the body take up glucose, especially in a patient who is glucose or insulin resistant. So we talked about this last week, when you eat sugar, the pancreas releases insulin. Insulin's job is to take that sugar and put it into a cell for energy. But when we're inundating our system with so much sugar, it can't do its job anymore. And it's like, okay, I give up. I can only put it here. The rest, this is going to just cause you a problem. I can't handle it. But if we're exercising, liver can help with that glucose uptake. And the WAT, that's your white adipose tissue. We call that Crisco in the can. That's the bad fat that we have on our body. And when we work out, it actually causes beiging of that white fat. And we have glucose uptake, we have a thermogenic browning. So, the fat is used for insulation of the white fat. The brown fat, the BAT, the brown adipose tissue, it's on our back and our necks, across our necks when the neural tube to protect and feed the fetus. And we still have it as we age, it just diminishes. But when we exercise, what we do have builds it, and it increases thermogenesis and beta oxidation. So it can increase, it makes it more metabolic. Whereas the white adipose tissue is just purely for insulation and causes health damage. And drum roll, the most important is the brain. When you exercise, you cause the brain to release BDNF, brain-derived neurotrophic factor. That's for learning and memory. Will also increase neuroplasticity, and it will decrease neuroinflammation. All these are super important as we age. How many people do we know that are taking care of parents who have some type of neuroinflammatory disorder? It's just frightening. And when we talk about exercise, just look at this picture. At the top is a 40-year-old athlete. This next picture is a 74-year-old sedentary man. And you can see in the middle is the bone. And you can see the muscle, which is the darker. Look how little the muscle is, and look how much the fat is. This is what sarcopenia looks like. This is a slice coming out of the thigh. So when we do it, this is an MRI. So if you have a slice of bread, pull a slice out. If you think of the leg as a slice of bread, and you pull a slice out. That's what we're looking at. This is the quadricep muscle. And then if you look at this 70-year-old triathlete, look at the density of the bone. Look at the nice blood around the bone. And then look at the muscle compared to the fat. It's almost better than the 40-year-old. So it doesn't have to be this sarcopenic patient right here. And I put these together for you because we have documentation, and this has been around for a while. I pulled some of this stuff up from earlier because I want you to know we know these things. That's why it's important for us as practitioners to tell you patients these things. Strength exercise is even more dramatic. A 92-year-old man, before and after 12 weeks of resistance training, increased his muscle mass by 44%. Look at the difference in that. I mean, yeah, he maybe have a little bit more fat there, but look at the difference in the bone. Look how much whiter it is. Look how darker it is around it, the blood there, and look at the muscle. So, man, that's just pretty incredible. So you can't give me I'm too old to work out. That doesn't work for me. Bone density, it's a big issue for women as we age, and men as well. And in our neck of the woods here, it's not that the patient falls and fractures. Usually they fracture and then fall. And strength really, precedes osteoporosis. So if you're working out, you're building good bone. And a combination of that is called Wolff's Law. So pressure on bone from the muscle of the tendon makes that bone stronger. But we thought that's what it was really due to, just that mechanical stress. But now we know that it's due to those myokines that we talked about from exercising, and in particular the myokine, the interleukin 15. And so this is my job security in my office. This is what I see every day. And these are all, what we're looking at when we're talking about all these musculoskeletal issues. And we're talking about bone density, our diet, what kind of food you eat, the sun exposure, your sleep patterns, your work shifts, are all have a big effect on that. And some of those are, and most of those are modifiable. Maybe you can't, change your work shift, but you can, change what you put in your mouth. And any of these strategies that we do for prevention can really help, catch it early, and we can really build a good architecture of bone. Now, we all are familiar with we call her the Truth Slayer. And those of you that are not local, you can go to InBody 570 near me and just Google that, and you'll find a place where you can go. If you're near the office, you're welcome to come in to do that. But it really gives you a great understanding of what's going on inside of your body, the fat, the muscle, the water, the bone. And then we can chart it so we can see where you're starting from and then see where you're finishing from. And once again, those myokines are super important in shifting you toward a more lean muscle mass. And blood lipids, we just talked about, a little bit about cholesterol. These numbers are kind of loosely associated with heart disease. Strength training really raises the HDL and lowers the LDL. And more importantly, it controls insulin and opposes inflammation and those inflammatory cytokines. And that's just what creates, we call them a cytokine storm in the system. And that's done from some of the foods we eat and sugars. So we want to look at that when we do that. If you're interested, I'm using a constant glucose monitor. We call that a CGM. This one is from a company called Stelo, Stelo. You don't have to have a prescription, so you don't get marked as pre-diabetic or whatever. I did it I was fascinated with blood sugar, what my workouts do to my blood sugar, what my lack of sleep or my good sleep does for my sugar, what my stress does for my sugar. And it's just fascinating. So I would encourage you, at least, if you need some coaching on that, do it for a month. After you do the 21-day, order one, just run it for a month. It's 2 sensors. I think it's about $100 for the month, and it will be amazing to you. It gives you some accountability because you can eat a food and watch that sugar spike. We were at Christmas time, and I did, we had honey baked ham. I was just the deliverer of, I didn't have anything to do with the meal. And so the next day I was doing stuff and I didn't eat till later. So I was doing a little bit of a carnivore diet. Well, I was doing a carnivore diet. So I took the ham, I cut the outer rim of it off because it was all sugar, and I ate the ham. No sugar on the ham. So you think that my blood sugar spiked to almost 180 after I ate that ham. That's how much sugar is in the ham. And you just don't think that. And if you don't know, how can you fix it? So making yourself aware of those foods that are triggers, and maybe you have a food you crave, eat it and see what happens to your blood sugar. It's a pretty interesting test. So hemodynamics. So when we talk about this, we're talking about simply that when you do cardio exercise, it's great. You can't hand your heart a dumbbell, so you have to be able to stress the heart. To calculate your maximum heart rate at birth, it's 220. Then you subtract your age from that. So I'm 66, so I subtract 66 from 220. So my maximum heart rate is 154, sorry. And that's like your speedometer on your car. You have that one speed at the very end of the speedometer, and that is your maximum heart rate for your car. Now, that doesn't mean you can't take your car that way to that speed. You're just not going to do it for very long, so you might get in trouble. And same thing with our heart. It gives you a place to take your heart, but you don't want to stay there. But when you do that, you stress your heart, which is called hormesis. And that hormetic stress on the heart makes it stronger. So when you do your walk, you want to do your walk or your bike or your whatever you do, swim, whatever you do, at 80 to 85% of your maximum heart rate. So 220 minus your age, and then multiply that by 80 to 85%. Most of you are wearing devices that you can check your heart rate. And then you want to train at that. And then intersperse 30 seconds where you take your heart rate up a little bit higher and then can recover for a minute or two. Take it up for 20 or 30 seconds and then bring it back down, and do that 5, 6 times. That's what makes your heart stronger. If you do the same thing all the time, you don't increase your cardiac output and you don't increase your fitness. Your body just gets, you maintain. And in this world, we need to always be kind of on top of our game and not just be sitting in the back of the seat of the car. We talked about omega-3s a little bit earlier. If you haven't done it, we have the Omega Quant test available. It's $40 to do, but it'll let you see what your omega-3 index is. If you're taking enough fish oils, if you're eating fish every day, or your cold water fish, if you're taking supplementation, are you taking enough? And for health purposes, you need to be taking anywhere from 8% up and over. And this is a great way to tell what your index is. We can calculate exactly how much you need to add to your diet so that you can have your optimal omega-3s. And the importance of that is it'll lower your reduce your risk for coronary heart attack. It'll reduce your risk for Alzheimer's. So, those are two big things. And I always tell patients, if you have if you have a parent that had any kind of neuroinflammatory disorder, then you need to get tested and you need to test your kids and start them now, because it's not going to stop the Alzheimer's if you're taking omega-3s, but it will slow it way down. Taking out that neural trash, super important. So aerobic capacity, we just were talking about how that cardio works. So cardio is important, but you really have to throw in those anaerobic, which is that little sprint where you're doing the high intensity. So we call that a high intensity interval workout. And that's where you take it up for the 20 or 30 seconds, try it for 10 seconds, and then recover for a minute, 2 minutes, 3 minutes. And just do that a few times. Get out of breath. That's okay. You're not going to die, I promise. And gene expression. I mean, the technology we have now is pretty amazing. I mean, there's a test called True Diagnostic that tests over 800 CPC markers, which tells you cancer and all that. And it actually will tell you how long you'll live. I don't know if you want to know that. I don't know. I'm kind of up in arms on that. I'd rather just do a really good job, and, I don't want to tiptoe to my death. I'm going to slide, rock, slam, rock and roll, hit the wall and say, damn, what a good ride. So, everybody's different. But they've identified 179 genes that are related to aging. And those genes can be reverted to youthful levels after 26 weeks of strength training. So it's the first successful reversal of aging at the genetic level in humans based on a strength increase of 50%. That is just spectacular. It's just, I mean, it's just mind-blowing to me. And then brain. I just talked about this, the myokine, that we call it the memory myokine, which is the brain-derived neurotrophic factor. It lowers your risk of Alzheimer's, depression, obesity, and it's an independent marker of mortality. It increases in your skeletal muscle due to exercises, and that's going to be strength training. Aerobics is good, strength training is better. And I just talked about the HIIT training, and that's where we bring it up high, and you don't have to do it that often for a week. I mean, we're talking, doing 30 minutes, 5 times a week. That's not a lot. I suggest you do 30 minutes of something every day. A couple days of weight training, a couple days of something cardio. And when you do, and of those workouts you do, I would look at 5 to 6 days a week. I do something every day. And if I'm tired, I take a day off, and I just, ebb and flow my activities. And 2 days a week, do one hard cardio workout where you do that high intensity, and do one strength training workout that's a little bit harder. So if you're normally doing 20 reps with a weight, go heavier weight and only work till you can barely get 10. Then you really stress that muscle. That's when that muscle grows. When you stress the heart by bringing that heart rate up and then dropping it down, that's when the heart gets stronger. And protein, you can have your protein now, and that's why I have you do the Veggie Pro and the Whey Pro that first week, because I want you to get adequate protein. But you have 9 essential, there's 20 amino acids you need. 9 of them are essential, which means you can't make them. You have to get them through diet. And the best way probably is to get them through animal. You can get them from vegan sources, but most of your vegan sources are considered incomplete. Your branched chain amino acids can come from pumpkin seeds and sesame seeds and yellow pea seeds. That's why we use the Veggie Pro, because it has those particular branched chain amino acids, which are building or for muscle maintenance and building. So make sure you're getting that in. And here's your total of protein you should have in a day. Take your body weight, your ideal body weight, divide it by 2, and that's your minimum protein for the day. So I weigh 130, half of that is 65. That's my minimum protein for the day. If I'm going to do heavy workouts or work out a little bit more, I increase my protein. I'll go anywhere from 65 to 100. If I have a really long, hard ride, I'll do up to my body weight in grams of protein. But if you're not doing the exercise, stay at that half your body weight of your ideal body weight. It's like your car. If you're going to just leave it parked in the carport and you're going to have a full tank of gas and you keep putting gas in it, but you haven't driven it, the gas is going to start spilling out. It's just like us as humans. If we're feeding ourselves, but we're not utilizing it, we're going to store it. And in humans, we know where it spills out around our bellies and back of our arms and our, behind the chunkadunk. You know that. And here's another. This is really, so I do a lot of these little 1-minute videos just to kind of give some information, spark people's interest to maybe to look a little bit further or ask questions. The faster you walk, the longer you live. This is what this whole study was. So if you find yourself getting up and just kind of you're predicting your lifespan. And I want you to have a health span. So walk faster. So I did a little video and I said, you walk fast, decrease your sugar, and put your socks on standing up. And people are like, oh, I can't do that, or I'm going to fall, or you're at risk of falling. Well, if you can't do it, that's indication. If you're afraid to do that, then that's an indication you have a balance issue. Lean against the wall and practice, but add some balance issues and balance activities into your routine in the day. If you brush your teeth, stand on one foot and brush your teeth, and then change the other foot, and then do both. Just kidding. So this is what I just was talking about with exercise. Your mixed exercise, you double in your money. That's when you do both cardio and strength. You're decreasing inflammation by 2, you're decreasing insulin resistance by 2, you're improving your body composition by 2, and you have a high reduced risk of decline. If you're just doing cardiovascular, you're still decreasing inflammation, decreasing insulin resistance, improving body composition, reducing good decline. But if you do both, you're really maximizing. And sedentary is just you're really the complete opposite. And if you look at this graph here, you can see where I have the disability threshold. And you can see the 3 colors, yellow being sedentary, the red being your cardiovascular, and your gray being your mixed exercise. That's really where you want to be. It's going to give you a longer life and a longer health span. I have people say, oh yeah, my grandmother lived to 100. Well, was she functional? Did she have her mind? Could she get out of her wheelchair? I mean, we don't want to be sitting in a wheelchair drooling on ourselves. We want to be, active, vibrant people as we age. We live in Florida. We work so hard to retire. We want to be able to enjoy that life. And that's why I'm so passionate about this. So in conclusion, strength training addresses all 10 of those biomarkers of healthy aging. So we want to support the body nutritionally with, I use like Ligaplex 2, which is a multi with bone, ligament, joint, tendon, and muscle support. And then I usually recommend cod liver oil for anybody over 50. And then I'll throw in some turmeric just to manage any inflammation that might be there. So those are just kind of my foundational for all patients, especially patients that are active. But increases their strength training, increases that physiological headroom. And done over a lifetime, that area under the curve is huge. That's what we want. Here's me being funny. Did you know 14 muscles are activated when opening a bottle of wine? Fitness is my passion. Once again, you can't have these. If it's in red, you can't have it. None. No. And these margin spreads, cornels, and all that stuff, you're never going to have them again after I just told you what I told you today. Caffeine and alcohol, it'll be there when you're done. If you're smoking, stop. Soft drinks, no, not regular, not diet. Just switch to your water. Use a water with electrolytes. And I use the Element, the letter L, the letter M, the letter N, the letter T, and I put that in my water instead. No nuts, beans, dairy, or grains, no processed or refined foods, no dried canned vegetables and fruits. You can have frozen. and no cured, smoked, or luncheon meats. We've got one more week. I will see you back this same time, same station, and we'll see you next week.